The viewing of this video podcast is for general information only. It does not constitute the practice of medicine, chiropractic, or any other healthcare services, including the giving of medical advice. No doctor-patient relationship is formed or implied. Please subscribe, like, and share if you find these podcasts useful.
Hi, in this video, we're going to be talking about how important your spine is for your health. We'll be talking about the structure of the spine and some of the problems that can develop as you get older. My name is Dr. Michael Hausman. I've been a chiropractor for over 44 years. I also specialize in chiropractic acupuncture, homeopathy, and holistic health. In these series of videos, we're going to be talking about health and the different things that you can do to make your health better. So, any discussion of the spine really has to talk about the function, the areas, the anatomy, and also some of the problems that can occur. So I think what we're going to do here for learning about our spinal column is start with the cervical spine. Right now we're looking at the C-spine, which is comprised of 7 vertebrae. This here is the back of the skull right here, which is called the occipital area, and the head actually fits right on top of there in a vertebrae that's called the first cervical or the atlas. This is the atlas here, and the head is actually resting on these 2 little facets right in the back of it. So the weight of the head is actually sitting right on those 2 facets, right in the back in here, and the head rests right on the top there with a bone called the occipital bone, which has a hole in it, which you can see called the foramen magnum, and that's where the spinal cord and the top of that spinal cord comes through after it leaves the brain stem. So the first 2 vertebrae do have names. The first vertebrae, as I had said before, is called the atlas. This would be where the spinal cord is here, and then you've got 2 arteries that come through called the vertebral arteries, and they're actually inside of the atlas. There's one on the right side and then another one on the left side. And what's interesting with the cervical spine too is that the vertebral arteries are actually inside of the spine, and that's going to be important when we talk about later on circulation up to the head, because abnormalities in the C-spine can affect blood flow up to the brain because the vertebral arteries are actually within those cervical vertebrae. So the atlas is the top vertebrae, and it serves a lot of functions. The main one being that it supports the weight of the head, also allows us to rotate our neck and move our head up and down. And again, it serves as a pathway for our vertebral arteries as well as the spinal cord. The second vertebrae, and there are 7 vertebrae altogether in the cervical spine. The first 2 do have names. The second vertebrae is called the axis, and the axis is right below C1. And the axis is important because it actually has an anatomical piece to it called the dens. I don't know if you can actually see it right in there, but that's the dens. And it's a little tooth that sticks up, and that tooth locks into the atlas, and it prevents the atlas from moving. There's actually a ligament in there. I can lift it up just a little bit, and that ligament holds that first cervical vertebrae to the axis and keeps that first cervical vertebrae stable. It's also important to note that any fractures or injuries of these top 2 vertebrae can lead to pretty devastating effects because your spinal cord is coming through from the top down. So if there's an injury here at the very top of the spinal cord, it's going to affect everything down below it, leading to some pretty major paralytic issues. So normally we've got our cervical curve, and here's the curve to the neck. You can see it's curved backwards. And that curve, that normal curve, is develops when we're just a little baby and we're on our stomach, and we start to lift up our head And this happens, at about 4 or 5 months of age. We start to crawl around on our tummy, and that neck comes up to be able to look around, and this curve develops, which is called the normal cervical curve. That curve can get reduced or reversed, and that is typically called a whiplash neck or a hypocervical curve, where we've lost some of that curve and it's straightened. And that creates a lot more pressure in the neck, because the normal curve, where it bends in this direction, provides a cushion and flexibility to the neck. So it's important that we have a normal cervical curve. The bottom vertebrae, which is C7, is, as you feel down the neck and you'll feel a vertebrae that's more prominent, that's C7, and that supports everything above it in terms of the weight of the neck. If we look between the vertebrae, another anatomical interest are these little washers that are between the vertebrae, and these are your discs. The discs are the spacers between the vertebrae. You don't have a disc between C1 and C2, but as you proceed down, you can see there are discs between each of these vertebrae. And the purpose of the discs is to provide cushioning between the vertebrae, so they don't touch. You don't have bone on bone. They also provide cushion, and they also create space for the nerve roots to come out. Here are your nerve roots here that are just behind the vertebral arteries. If we get really in close there, you can see there are those nerve roots. And so if those discs start to compress or begin to bulge, then we're going to tend to see oftentimes compression going on either in the nerve root, potentially the vertebral artery, or if it goes into the spinal cord, we can have a problem which is called spinal stenosis, which is where the disc is starting to compress either the spinal cord or the nerve roots. Other things that can happen to the cervical spine is we can have pinched nerves, which often happen between these vertebrae, where the nerves can get pinched, and that often can happen either from a disc injury, where the disc starts to protrude into the intervertebral space or intervertebral foramina, or the vertebrae can end up with twists in it that can create pressure on the nerve roots as well. Thank you for watching this intro to the spine. In our future episodes, we'll be talking about the thoracic, lumbar spine, pelvis, and some of the problems that can occur, and also ways of maintaining your spine and how to get it so you stay healthy. All right, see you soon.